Hi, everyone, and welcome to The X, a podcast from inside Silicon Valley about how experience shapes everything from products to businesses to entire industries. I'm Brian McLean, and I'm here with Demetrius Madrigal. Today, we're going to talk about the rise of telemedicine and how the way in which we manage our health and relationship with our healthcare providers is changing right in front of us, and what's to come in the next 5 years. Good morning, Dee. How you doing?
I'm doing pretty good. I think this is going to be a big topic the next few years, especially as everybody starts going back to the doctor once the vaccinations are fully rolled out.
I agree. I mean, during the course of this pandemic, did you have the opportunity to do any of these remote visits with your doctor?
I have not. Well, it makes a lot of sense once you're kind of social isolating. You're not being exposed to any kind of pathogen, so there was really nothing to see the doctor about. I have used some remote kind of chat stuff for my pets, and I found that pretty useful when it's just, I have a simple question about, a product or some symptoms I'm noticing. It's pretty convenient.
Yeah, it's funny that you say that. I never even really thought about this in regard to pets. When we were talking about telemedicine and wanting to do this podcast, I didn't even really consider animals in that. That's really cool. I've actually tried it out a couple of times because, a few times my son, I can't remember exactly what it was, but something with, he had like a little thing in his eye and it was kind of swollen. And I was like, well, we don't need to go to the doctor for that. Maybe we should try out one of these online things. And you click on it and it's like, boom, doctor shows up and they can use the camera and they look closely and they're like, oh, that's okay. It'll work itself out. Just keep washing it regularly and that kind of stuff. So it was really nice. And I've always been pretty bullish on this, as you know. The thing that I like about it is it fits a certain type of symptom and issue, right?
Yeah.
So like, for example, like the other day I cut my finger and I looked at it and I was like, this will be okay. Cleaned it all up, wrapped it all up. But then there was like a part of me that was like, it's kind of a deep cut. I wonder if I should do one of these remote visits and have them take a look and see if I need stitches. Now, ultimately, I didn't do that, but I think that would be like a great opportunity to kind of stay out of the hospital, but still use my super high quality camera to allow the doctor to take a look at it and say, no, I think that'll be okay. Or no, you got to come in because we're gonna have to put 2 or 3 stitches in that.
Yeah. And the reality is the vast majority of stuff that we encounter and can benefit from medical care for are fairly simple things, some direction on how to clean a wound or maybe you can get some antibiotics that you don't necessarily need to go into a doctor for if it's something that's relatively common. You can get all that stuff without necessarily having to take the time to go down there, take up space, load up their day, like everything right now. My brother's in medical care, and he said that as people are getting more vaccinated, they're getting slammed with everybody who's been putting off going to the doctor now. So everything there is just completely packed. So if you can offload some of that to a remote solution, then you're just increasing the capacity of the system overall and making it easier for people who actually really need to see a doctor to be able to go and see that doctor and not be held up because somebody else has, a minor cough that they're just getting checked out.
Yeah, you mentioned something in there, though, that's really important. You said prescribing medication. Mm-hmm. That's a tricky one. That's a gray area. I feel like that one makes me think that you would need to be in the office and they would need to check your vitals and all those things before they can actually say, oh, you know what, you just need antibiotics. That's the one where I feel like they're going to have the hardest time kind of integrating or may just never integrate that into telemedicine.
I think it depends. I've definitely had the experience going back years. My doctor gets incredibly busy. So, and he knows me, he knows my vitals, he knows my response to it. I don't have any medical allergies, anything like that. And I'm, reasonably educated when it comes to medicine, partially because of my brother and other family members who are in the medical industry. So I can call him up and tell him like, hey, here's what's going on. I've got a fever. I've got swollen glands. I've got this or that. And I've had him prescribe antibiotics over the phone. So I think that is a possibility based on the situation, based on the nature of the illness, based on the medication. SSRIs, for example, like Prozac, they're very, very safe. And it's one of the reasons why they get probably overprescribed a little bit. So there are certain things that are very safe to prescribe remotely, and or even just direct somebody to an over-the-counter option that works very well. I've had doctors tell me, like, try this out, and I'd never even considered trying out that medication, and it did wonders for what that my specific ailment was at the time. So even just having that knowledge can be really helpful.
Yeah, having spent our entire career up to this point in experience, research, and design, I feel like this is one of those industries where you have to get that recipe right for when the remote connection is used and when the in-person connection is used. I mean,
Yes.
that's kind of where the magic lies, right? Like, you have to say, okay, as a doctor, you might say to yourself, like, if a patient has a non-threatening illness, or they believe is a non-threatening illness, I want to drive them into the video connection first. And then if I feel I can take 30 or 40% of those patients off my plate because it was something that's minor, then I can take the rest of them and bring them into the office. If that's the case, I mean, it ends up kind of streamlining your business, because ultimately, especially in primary healthcare, internists and stuff, I feel like the majority of their revenue or income is made through the number of patients that they communicate with hour by hour basis, right? So I know you probably make a little bit less or you can bill a little less when you're doing a remote connection, but it also means you might be able to handle more patients in a given day.
Absolutely. So
Right?
I think the way this would work out in an ideal case, in order to really help the entire system, is if it's, like you said, can really help out the distribution between who can be seen remotely and who should be seen in person, so that all the doctors, nurses, medical professionals can spend more time on the more serious or more complex cases that can benefit from that. And I think that we've probably all either personally experienced or know of somebody who had like some illness that just wouldn't resolve, and they tried different things, and eventually they come across that one doctor who spent a little bit more time and did one more extra test and found out a new diagnosis, or was aware of some new treatment that resolved their issue. And I've seen that happen multiple times just in recent years.
Yeah, when we were prepping for this podcast, you had said, well, what happened statistically from 2019 to 2020? Because we're always looking at these shifts and changes and whether or not adoption is actually growing. I don't know. We hadn't looked at the numbers yet, right? And I did dig those up, and I wanted to share those with you. So there was a McKinsey study that was done that said that 46% of patients now say they use telehealth for some of their visits, and that is compared to only 11% in 2019. So that's a pretty big jump. Now, I know that jump was because of the pandemic and people didn't have the opportunity to go into the doctors, but the same study showed that 11% that used telehealth in 2019, when asked if they're interested in using telehealth in 2020 and beyond, grew to like 76%. And I think that this is a real important point to make to our audience, is that part of adoption, part of an industry growing and changing, is these huge opportunities for people to try things out, right? So if it's really easy for you to just quickly make an appointment, get in your car and drive to the doctor and not try out these solutions, then the growth is usually quite slow. So your doctor might say, hey, next time, you can try just logging in and talking to me on your computer. And you're like, yeah. And you kind of go on with your day, and maybe you'll think about it, maybe you won't. But the fact that you were forced to use it during this pandemic makes you more likely to adopt it as a standard tool post-pandemic. So I kind of feel like this was like the big test of, does this technology work? Is it helpful? Can we scale it? And can we basically streamline the healthcare process by applying this technology into it? So what are your thoughts on that? Like this the data and how it's showing like this massive adoption and massive testing of this technology.
Well, I think it's kind of a theme that we've noticed is that the pandemic helped to accelerate things that were slowly growing. The ways in which kind of industries were slowly moving, it accelerated everything because there was this constraint on the system that people had to adjust for. So I think that after people who might have insisted on, no, I'm going to, or, either inertia or just because they were more comfortable with it or it's what they'd always done, had kind of always gone to the doctor. Now they had tried out remote care and felt like it worked out well for them, and also just reduced kind of the amount of work involved of going down to a medical care facility. And if you think about, we're in cities, you and I, that have plenty of nearby hospitals and clinics and things that we can go to. But if you're talking about somebody who's further out, somebody who's living in a rural area, living up in the mountains or something like that, getting to like a hospital or a specialist or even like an urgent care clinic can be, a significant time and travel commitment. That could be 25, 35, 45 minutes to an hour to get to a place that can be qualified to help them with something.
It's true. And, whenever we talk about telehealth, telemedicine, I feel like the only thing that comes to mind are these remote appointments and video calls. Mm-hmm. But I did some research on this, and I wanted to share it with you, is that there's a lot of other areas that are actually growing and that they are looking to expand to, but definitely are going to take more time and more innovation in order to get there. So the number one obviously is the remote appointments and video calls with experts. The one thing that people don't think about or realize all the time is that actually extends to dentists, therapists, dermatologists, as you said, veterinarians, pet doctors, right? Like the possibilities with those are basically endless. So that's really great. And I feel like, especially like dermatology or like, oh, I have an abscess in my tooth. Do I need to just like wash my mouth out and it'll get better? Or do I actually have to go in and get it checked out? I feel like there's a big opportunity there. But I started digging even deeper. And some of the stuff that I found was that a lot of companies are looking into this idea that if we can track our biological data at home and have that connect to our online profile and account with our current internist or doctor, then they're going to get a much more accurate picture of who we are in our normal life. So that includes at-home health monitors that will automatically upload your data, temperature checking on a regular basis, blood pressure, cuffs and things that you can purchase and have at home, glucose level testing. They're really pushing the limits to creating good quality hardware that you can keep at your house, where most of the medicine, most of the wellness is happening at your house. And then the data is getting sent to your doctor so that when you do go in for your annual physical or whatever it is, they can actually look at that data and say, wow, we looked at your heart rate on your Apple Watch that's been running for the last year. And it looks like, when you work out, it looks really good. When you're resting, it looks really good. And I saw you took your blood pressure, a couple of times with the cuff that we gave you, or maybe even from the Apple Watch. And those numbers look pretty good. So we're not really worried about the fact that your blood pressure is a little higher while you're in the office today, because it seems that things are going quite well.
Yeah, and we know, you and I have actually worked on a few of these things. Has kind of been identified a while back that the real value of wearables ultimately is going to be the ability to kind of track real-time health information. These are things like you can get a glucose meter integrated into like an interstitial needle that you wear on a wearable bracelet that could be built into a smartwatch, that can track your blood glucose and just tell you when you're getting low or you're getting high. Because it's an interstitial needle, it's not penetrating your skin. You're not getting a pinprick like you in the old school ways. And we've also seen things where people can wear bracelets that can track like vibration for us. If they are, if they're in like an ocean environment, they're using a jackhammer or something, we can tell them, it's time to stop using this jackhammer and transition to somebody else, because you're going to start doing damage to to your wrists. Same thing with ears. You can have sensors in your earbuds that can sense if you're getting too much, or your earplugs, if you're getting too much sound through. Those are all things where, if we can figure out both the processing of the information and communicating that information to the right medical professional at the right time, keeping HIPAA compliance all in place, we can do a lot to improve the healthcare outcomes for just about anybody, especially people who are older and starting to have health issues. And we can have like basically your watch now can do a lot of EKG functions and determine if somebody is starting to have arrhythmias or other kinds of things going on, and get that information to a right medical professional who can then reach out to that patient and or get a notification to that patient to go into the clinic and get checked out. So that I think has been a big deal for a while within like the wearable market. It's just difficult to get everything kind of dialed in.
Yeah, you're also seeing it too in cancer screenings a lot more, as well as viral screenings. So I heard someone talking the other day on a podcast about how, how with the COVID, they do a swab in your nose or whatever, right? Well, if you have the ability to do something that's very similar to like a pregnancy test when it comes to COVID, when it comes to influenza A, if it comes, all these different types of viral things where you can actually like test yourself for it at home, wait 15 minutes, look at it and say, okay, I'm positive for COVID, or I'm positive for the flu, or whatever it is. By doing that and then having that data sent to your doctor and then doing a televisit with your doctor, you can determine whether or not you even should come in, because when you come in the office, you have the opportunity to spread the virus, right? Mm-hmm. Or cause issues, right? So there's even that where it's like, this could be done at home for the most part, and you can pretty much stay there and they can give you medicine and more or less monitor you, right? Well, now, a lot of hospitals are also doing the colon cancer stuff where they're actually sending you, I think it's called Cologuard, where they're actually sending you the kit when you hit a certain age, and you're basically testing, colon output and then sending it in, and they're just looking for DNA that indicates that there could be issues and things like that. And then at that point, they might schedule a colonoscopy or something like that. It's amazing how quick this is moving, because in general, the medical industry moves quite slow. Yeah. So because you don't go to the doctor on a regular basis, when you go in and suddenly they're like, oh, we have this new thing to help you with your broken hand or to help you with COVID or whatever it is, you're like, wow, where did this come from? This stuff, when you work in the industry, it actually moves quite slow because you have to test it and you have to get it approved, and it costs a lot of money to go through FDA approval and all that kind of stuff. But it seems to be accelerating, which is really exciting. And then the recipe of figuring out like how this all ties in so that there's no mistakes. There's no like, hey, you're fine. And then suddenly you're not okay because you didn't go see your doctor in person. Mm-hmm. Trying to remove that, I think is key and paramount to this industry growing to where people hope it will.
Yeah, I mean, you think about what kind of samples that you provide for lab work. A lot of that can be done at home and then just dropped off somewhere, like urine samples, saliva samples. A lot of that stuff can just be dropped off. It's just kind of like when you need a blood sample or something that you actually have to go in and see a professional to draw that blood, or a few other things, like obviously like bone marrow or something like that is going to be much, or cerebral spinal fluid is going to be also more complex. But a lot of the stuff that people encounter in a more of a day-to-day kind of sense, that can be like collect your urine at home and then put it in this bag and then drop it off at the drive-through.
Totally. Yeah. And, there is this other side to it, though. We're kind of talking about the very positive side of people who are pro having all of their kind of stuff done at home and having their data tracked and having their data shared and that kind of stuff. I've actually talked to a lot of people that said it makes them nervous to have all these devices on them tracking their health, not nervous about like theft of their data or sharing their data, just nervous to know that at any moment your watch could buzz and say, you have a problem. There's like a big anxiety there with constantly tracking your health because you're constantly thinking about it. What do you think is like the perfect formula for doing this without making it so that it feels like the majority of your life is dedicated to just monitoring your health, constantly.
Well, I think it is kind of having those wearable devices serving other purposes. So you don't necessarily think of it as like a health monitoring device unless for some reason you need to take action on your health. So it's a time telling device. It's an entertainment device. It's a communication device. Those are all things that, smartwatches are doing now. And we can all think of as those devices existing for that purpose so that we're not focusing on the other more important use case. But the health monitoring healthcare use case it's the game changer for wearables. It's the new use case that you can't do through your phone or your laptop, right? It's the wearable exclusive use case. So if you can integrate it in such a way that it's not intrusive, it's kind of monitoring in the background, it might be a little bit more aggressive for people who have pre-existing conditions that have to be monitored. You remember the life alert stuff, right? Like where,
Oh yeah.
You fall and you can't get up, or somebody's unconscious in their home, or their blood pressure just spiked or dropped precipitously. Those are things where it's we used to have services we'd spend a lot of money for, where you would get a phone call if something's going on with your mom or something, and you can go to their house and figure that out. That can all be automated now. And if you're in a connected home, you can then take a look at a camera, see how they're doing, give them a call, all those kinds of things that are available to you. It is kind of like taking that use case though, and a lot of the work that some of these kind of innovation houses do are look at getting the interface out of the way. Some of that's automation, some of that's making it super usable so you don't even think about it. But there's a phenomenon when people are being observed in some way, either through some kind of a human observation or automated observation, where they habituate to it. They get used to it and they don't notice the cameras anymore. We've done this with ethnography. Eventually, people don't even notice we're there anymore and they just live their normal lives. So I think that is ultimately where it will go, as long as you can kind of, make this thing unobtrusive and have it make sense that it's there for other reasons. Then the whole idea that you're being monitored for health reasons is kind of falls into the back of your mind. You don't notice it as much.
Yeah, I want to give you two medical kind of fails that happened to me to give you an example of what I was thinking when we started talking about this. So I went and had my physical like a year ago. And you know how when you go, they send you down to do all your lab work and everything. And then you leave and you go home, and then you can log in basically to the system, and then it shows you what the results are. Well, what I realized was they sent me a notification on a Sunday night at like 11 p.m. Like I was like laying in bed, like I think I was already asleep, and it was like bzzz on my phone. And I was like, oh, what's that? And it's like new test results. And it's like my heart started pounding because I was just like, why are they sending me test results at 11 o'clock at night on a Sunday? Right? Like I like freaked out for a second. And then I like logged in, and it was like all these numbers that I don't understand. Right. And then finally I realized that like next to it, it has a little column and it says like normal, high or low or whatever it is. Right. And they were all normal. And so I wrote my doctor in the morning and I was like, hey, thanks for the test results. FYI, like, I had to say this, D. I mean, this is what we do, right? I was like, FYI, like this notice came to my phone at 11 o'clock at night and like freaked me out because like I didn't know why it was sending me test results. Don't you think maybe like the test results should be sent to me like once you've confirmed them and sent me an email already and just said, hey, FYI, your test results look good. I just approved them. You'll now receive a copy of them, instead of me receiving them before I even talked to my doctor.
Yeah, I mean,
I was like, well, I don't even know what all this means. I mean, what if there was something that said high on it? Maybe I'd be like freaking out all night on a Sunday, and I didn't know, right?
Yeah.
And so
Brian,
he was
let me stop you there for a second, because I feel like this is something that's a little bit idiosyncratic to you. If that had come to me, I would have been like, oh, cool, there's my results. I'm just going to assume it's mostly fine, and if there's anything serious, then they would have contacted me already. and I don't know why, because you're one of the people who's probably in the most perfect health of anybody I know. But do you maybe that's because you have a little bit of anxiety around it. But like for me or most anybody I know, even people I know who have some pre-existing health issues, they're going to tend to be like, I'm sure it's fine. So I don't know if that is necessarily going to be a fail for everybody. If I saw it, I'm like, okay, let's take a look. And if there's anything high, I'm going to Google it real quick and see if it's something serious. And if it is something serious, then, and a lot of that is tied into whether or not you're feeling symptoms. And if you're educated in or have any level of education in healthcare, you'll know like, all right, well, what symptoms do I need to would really be alarming, and which ones are like, hey, it's kind of normal to have a scratchy throat when you get into spring, right?
Yeah. Well, I'll tell you one thing. He did write back and say, "Yeah, sorry." I think he said something like, "Sorry about that. The system is not supposed to send out the results until I've clicked like send results."
Mm-hmm.
Or he said it was probably automatically sending results because there was nothing flagged.
Yeah.
Right, as being an issue, right? But here's the point of that, right? It was no big deal. It was a momentary thing. Like, fine, work through it. The point is that subtlety, that little bit right there can make a difference for a lot of people, right? It can make a difference to how you feel or how they respond to technology. For example, let's say the Apple Watch predicted that I have AFib, right? There's a very gentle thing where it just says like, hey, we noticed that your heart rate changes or whatever. You might want to ask your physician about this, right? It's very gentle, right? But what if it said AFib, 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 and just was flashing like on your watch, right?
Yeah.
That's an example of the exact opposite of how you should design for this, right?
Well, I don't know. I think it depends on the person. If it's for you, I would be like, let's keep it nice and gentle. If it was my mom, who prefers to ignore anything that's medical unless one of me or my brother go to her and tell her, like, with handcuffs, we're taking her to the doctor. I prefer it be alarming so that she'll actually do something about it. The other thing I'll say about the test results going out before the doctor can notify you. Honestly, sometimes to a certain extent, not all doctors are created equal. And there's definitely cases in which I felt like I have had to get on a doctor's case, not always for me, sometimes for other people, about like, hey, this thing here is relevant and we need to address it. And the doctor, I don't know what they're doing, but sometimes you have to be your own advocate. And in order to do that, you need the information independent of a doctor who might be too busy doing something else.
Yeah, it's a good point. I mean, and they're very busy. My doctor's amazing, by the way. I love him. I don't want to make anyone think otherwise. It was just for me, like analyzing the system, right? From the brain of a user experience designer and researcher, right? Like I see the system and I go, I mean, do you remember we met this guy? I can't remember his name, but anyways, he started this company where all he did was change the intake process for people. Do you remember this? And it was really amazing. I think he sold the company, but when you go into the doctor and you sit down and they ask you to fill out all that information, he changed the intake process to be super fun and exciting, like a game. So you can almost hand it over to your kids where it says like, what's your birthday? And then you put in your birthday and suddenly balloons would come up. And then it would say like, when's the last time you got some exercise? And you'd be like, tomorrow or yesterday. And then it like tomorrow, I almost said tomorrow, yesterday. And then suddenly it shows someone running and the kids were laughing and stuff. Yeah. It was really cool. It was such a simple design think around where is their anxiety when they walk into the doctor's office, and how can we relax them and make them laugh prior to going into their visit? And I thought that was genius. And it's just such a small thing.
I do think that for things like that, it's like self-reporting medical things, there is an opportunity for some element of gamification, especially for fitness stuff. For some things that are beyond your control, you'd want to kind of avoid that kind of thing, or you'd be very careful about it because gamification can get away from what you intend sometimes. So, but I think for things like intakes, for things like for fitness, like that's one of the things we've seen with I think was it Peloton and stuff. They have some gamification as far as a leaderboard for
Yeah. Yep.
performance and things that is helping to motivate people to engage with fitness. I think there's some great opportunities there. And ultimately, I feel like for intake, so one of the big issues within medical is the management of information. And it really ultimately probably should be some level of autofill that's going on when it comes to intake or
Hmm.
medical forms, where it can be stored locally on your own device, and then you can scan a QR code or use NFC or something like that in order to just tap. And because it's stored locally and encrypted, it's very secure. You do a tap. It can use some kind of expiring token, the way that they use for payment systems. And it just tells your doctor's computer systems, here's all of my information that was stored locally on my local health app that has now been communicated to you, so that you don't have to dig through old records. You don't have to kind of reprocess old information. It's all right here.
Well, a lot of what you're talking about is recall, right? So a lot of the questions that they ask you is like, when was the last time you did this, or have you ever done that? But if you have actual data on your phone or your watch or
Mm-hmm.
whatever it is that you can transfer over that says, I actually did these things, like I rode the Peloton 4 times last week, is better than saying, I think I work out about 3, maybe 4 times a week, right? Like it's just more accurate data, which
Yeah.
tells a
If you
more
have an
complete picture.
API, if you have a health app that tracks, that stores, like, all right, well, here's my blood glucose level of the last 3 doctor's visits and my blood pressure over the last 3 doctor's visits, and has an API that can communicate with your Peloton app or your step tracker, then all of that can be communicated through one tap, and the doctor can see all of that, and it's not based on reminiscence effects or self-report inaccuracies or any of that. It's just all there, and it's less work for everybody, and it can be done in a way that's very secure and safe.
Absolutely. Well, let's take a step back for a second and talk about kind of the advantages and then the challenges to this type of new form of medicine, telemedicine. So
Mm-hmm.
I compiled a list here, and please jump in and add if I'm missing anything. But so the way I see it is the advantages are this. By having telemedicine, you have fewer physical visits to the doctor. So that's the driving, parking, checking in, waiting appointments, driving home, etc. Like that whole process of like almost taking up like a half a day, right? Of doing things. It's quicker confirmation of what's next. So a fast way to kind of take the anxiety away or accelerate the process of getting help. So if you are really nervous about something, like you sliced your finger wide open, well, instead of sitting in the ER for 3 hours for them to look at it and figure out what to do next, you show someone on camera, they tell you, don't come in, you're fine, wrap it up, whatever. Or come in immediately and we'll take care of it. At least you know what you're getting into, right?
Mm-hmm.
The third one I had here was there's more touch points for your doctor. So they get to see you more in your natural environment, your ability to be at home when you're communicating with them. I'm going to imagine that most people are a little more comfortable, a little more open, a little more honest when they're sitting in front of their computer in their own home than maybe sitting in a doctor's office. I don't know, but that's just a guess of mine, that it gives them a better picture of who you are.
Mm-hmm.
The reduced barrier to getting help, which is the one that you talked about a little bit, which is, if you're just out in the middle of nowhere because you want to live in a more remote area, this is a great way to still have some sort of connection with the medical field, right? You don't have to try to figure everything out on your own or go to your doctors once every 10 years,
Mm-hmm.
right? You can actually see them on a regular basis. And there's also a lot of anxiety around visiting doctors. Like I have so many people that don't like going. They're just like, I don't want to go. But they totally feel fine to click on a link and chat with them, or do a video call, or do a phone call. So it's just another tool in the toolbox. The next one I had was reduce cost. I don't know for sure how this stuff is billed. I tried looking it up and it's kind of all over the map because I think it's kind of new. But I would imagine it's a reduced cost. Like if you don't have any insurance, I'd imagine it's cheaper to do a quote unquote Zoom call with your doctor than it is to go to a doctor's office. I mean, do you have any data on that? Or have you heard anything from your brother?
I know from some people's experience with Kaiser. Kaiser tries to push people into kind of remote consultations because it helps them to keep the cost down.
Uh huh.
Now, there's a difference, obviously, between keeping the cost down and that cost savings being passed on to the consumer. So that is one thing that will probably need to get hashed out. If it's reducing costs, we have to make sure that it's not all of those cost savings aren't just absorbed by the healthcare providers and the insurance companies.
Yeah, good point. And then also collectively, this should make the entire healthcare system more efficient while making preventative care more accessible, right?
Yeah, so I think there's a couple things to kind of keep in mind on this. And part of that is, number one, just making care more available to the consumer, right? To patients, to individuals. Like we said before, reducing that barrier to getting help. So for people who, for example, need or could benefit from, I should say, some kind of psychotherapy. And the vast majority of people who could benefit from psychotherapy are not necessarily people who are diagnosable for a psychological disorder.
Mm-hmm.
What I mean by that is when we were in grad school and we took a few clinical classes because it was relevant to a lot of the stuff we were doing. One of the things that came up over and over again is if somebody's coming to you and they're telling you that they're depressed, make sure that they're not just sad because of the situations of their life. If somebody says to you that they're depressed and their spouse just passed away, then it's important to see that as them not being depressed, but them being bereaved and their sadness being a very, very natural and ultimately healthy response to the situations of their life. Now, that said, that person can probably still benefit from some grief counseling, from some interaction with people, maybe in a support group, and all of that can be potentially done remotely. So if that person is living out in the mountains or somewhere remote, then they can still have access to that, or they can just have some talk therapy with somebody who can help them work through some issues, or get some kind of behavioral interventions where they can fix some bad habits. The other side of that is that people who need to get regular screening for things can get those without having to go through all the rigmarole of hours of waiting or months of waiting for an appointment to be available, and then hours waiting in a waiting room or in an exam room for all of the things that need to get done. So it just makes everything more available. And all of the benefits that it provides to the patients, there's a similar benefit to the healthcare providers. So fewer physical doctor's visits, for example, means fewer people in your waiting room as a practitioner. So then you can spend more time and provide better care to the people who are there in person, who have more direct needs. That, I think, could provide a great deal of benefit to the healthcare system.
I mean, does this mean that doctors might be able to shrink the size of their offices and things in the future?
Well, I think most of them find that they're, in my experience, a lot of them find that their current offices are a little bit too small, so it could reduce the need to expand. The reality is, in the United States, there is a shortage. If you think about supply and demand, this is why healthcare costs are so high. There's a shortage of healthcare available. And that's why everything is compacted. That's why we have such long wait times for everything. And it's why everything's so expensive. So aside from just flooding the market with new doctors and nurses and devices and testing and all of those things, finding efficiency wherever we can will have a huge benefit.
True. I mean, but there are some challenges to this too, right? I mean,
Absolutely.
You and I are very bullish on this and see it as a great opportunity to make the system better. But there are some challenges, and I wrote a few of them out here that I wanted to run by you and talk to you about. So one is that our healthcare providers actually trained to assess over video? I would imagine that you probably have to go through a little bit of extra training to talk about what is the best practices for communicating with someone over video. Like, for example, like if you can't clearly see something, like you're a dermatologist, let's say, and you can't clearly see what they're looking at, you probably have to like default to saying you have to come in because I just can't see it. It's not clear enough for me, or maybe even using the technology to take pictures on your side, or you know what I mean? Like, do you think there's additional training, or do you think you just jump on a video call and just do what you normally do as a physician?
I think there is. I mean, we know this from when we're doing our work, whether we're doing it remotely or if we're doing like something in home, that there's a different set of kind of tools that are involved. So I think it's something where it will be kind of a younger generation of doctors and nurses who are gravitating more towards providing these remote consultations. And the original or the first consumers will be people who are young adults, people in their 20s, maybe early 30s, who don't have a lot of health problems, who just every now and then might need some antibiotics or need some triage about like a wound they got while riding their bike or something. That will kind of be the test bed where everything kind of gets worked out to start. And those people, I think,
Yeah.
will be both more comfortable and more initially capable with communicating remotely.
Yeah. Yeah. Because the next thing I had on my list was misdiagnosis.
Yeah.
Was what percentage of these video calls leads to misdiagnosis because they're not doing their basic check your throat, check your ears, check your nose, check your temperature, check, you know what I mean? As they do every single time you go in for no matter what you're going in for.
So I think this is the biggest danger in this process is if it is done in a way in which it is, we're maintaining the current resources available within the medical system, but we're providing more efficiency, then it can just make production overall greater. If we abuse this system in order to try to cost cut while getting more out of whatever it is, then ultimately what will happen is that people will stretch what you should be doing remotely beyond what it should be done. So then instead of calling people in and getting them a proper screening for something, they'll just continually tell them like, oh, just try this, try that, blah, 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 because they're resistant to bringing them in for whatever reason, because of cost or just availability or just too busy. Then it could end up having worse health outcomes for some individuals.
That's a tough one. I think that's one that there's going to be a lot of probably studies done on and best practices applied and checklists and all these different things in order to try to mitigate misdiagnosis. I once read this study that said that something like 80 to 90% reduction, there's an 80 to 90% reduction in errors when inside the operating room when a checklist is applied before and after the patient comes in.
Yes.
So like a checklist that's run like as they're doing okay. So the example was someone's going to go in and they're going to have a procedure done. You run through the checklist before the procedure. You run through the checklist to back it out again to make sure that you're not forgetting anything inside of them when you're sewing them up, like all those types of details, that it like cuts it by like 90% or something by simply having a checklist. I feel like this is probably where that's something that will probably happen with this as well. Right? Where they have to follow this procedure, almost like when we do research with IT centers that are doing customer service. You know how they always have that checklist of all the things they make you check on your computer before they actually listen to your whole story about your problem. They're like, okay, reboot your computer, do this, do this, do this. And they have you go through all that. They've learned the same thing, which is they can pretty much solve any problem and not have any issues with misdiagnosis on computers simply by having a checklist that every single person has to go through.
Yeah. I think one of the most important things is in that checklist or somewhere in the heuristics needs to be, all right, here are the things that if you hear from the user or the patient, that it triggers like, all right, well, you need to come in. And it should be just like, all right, if you hear one of these things, tell them to come in, because even if it turns out to be nothing, it's better for us to get them checked out and make sure it's nothing than for it to be something that we missed.
Correct. The next one on the list here is data management. You had written some notes here about this. Do you want to explain what you were talking about?
So one of the bigger challenges that I've come across is just data management within healthcare systems. And that is the amount of times that somebody had to resend over somebody's medical records, or some doctor wasn't aware of somebody's medical history because they didn't have the time or the availability of those medical records. It just keeps coming up over and over again, and it's a challenge. For me, it seems something that's eminently solvable because it's been so fixed within our industry. Like it's so easy to pass documents back and forth within what we do, that it's and plus we pass back and forth high res video and audio recordings and all kinds of things that are much more challenging to pass back and forth than just documents. It's something that when you're providing like a online consultation, or you're interpreting some kind of lab results or something, you need to have that person's medical history in front of you in order to have the context to make sense of it. So there needs to be an improvement to the system where anybody who is working on a consultation for that person, especially if you're doing a remote call-in because something is going on or you want to get something checked out, that person is aware of your medical history. They're aware of whether you've had heart disease or a history of family history of colon cancer, or you've previously had a stroke or something. Those are all bits of information that are absolutely essential for them to interpret your current symptoms. So there has to be a system that can be efficient, can be secure, that can be HIPAA compatible, that can get that information to the right person at the right time.
Yeah. And I think you just said something there that tapped into the one that I had written right after you were talking about data management, which is, you said secure, and mine was privacy.
Yeah.
So like, how private, is this data, right? Like, are these calls recorded? Who has access to the data? Are they going to be wiped after the conversation occurs? Like, I think there's a lot of questions there revolving around that. Most of the people that I've talked to regarding this stuff said that of all the things in their life that they worry about when it comes to privacy, it's their financial information and their health information. This is one of those ones where we have to properly address that and make sure that we, take that out of the equation, so they're not basically pulling away from using these tools that can be very helpful for them just because they're worried about what's going to happen to their data.
Yeah, I know that people are concerned about it. I think if you're not like a public figure or something, it's not going to be a huge danger for people. I think the biggest danger is actually going to be ransomware. So if a ransomware company can get into a healthcare organization's records and basically steal those and ransom them, and you can't get access to somebody's, now they're asking for like a $1 million ransom in order to get access to their medical records again, then that's something that needs to be addressed. But with the right redundancies in place, with the right encryption in place, it drops that danger down almost to nothing. Now, it's never nothing.
Yeah, I would agree with that.
It can become very, very secure. And we've worked with NASA, we've worked with other government agencies, we've worked with FAA and work in, vulnerable areas like air traffic control systems. We know that there are remote systems in place that can be very secure. So you look at cryptocurrencies, for example, and something like blockchain could potentially manage something like this to make sure that records can't be falsified, they can't be modified, they can't be erased, then can really address a lot of these issues that people are concerned about.
Yeah, and that's a really good point. You think about blockchain, it's one of those systems where it would really help a lot with the sharing of information. So like if you go to your ophthalmologist and they want to see some information from when you had a physical, they can simply request a token, the token's provided, boom, the information comes up, and then, they close it and it's back stored, securely again, right? Like there's many ways to do this. And I think that in the future, we're going to see privacy be one of the top components of this, like companies dedicated just to figuring out privacy for medical information at the highest levels.
Yeah.
And then the last one I had on the list here, which we already talked about, was prescribing medication. I just have like this huge question mark around this one. Like, when can you do it? How can you do it? Is it legal to prescribe medication without doing a full checkup, like all that kind of stuff? And I know that your doctor had prescribed some antibiotics, but like, what about the next level of that? What about like, somebody who lives really, really far away and they need some medication that does have potential side effects, or does require a physical, but they maybe can't get to the doctor. Is there a way to still do it? Or are we just going to say, oh, nope, you got to go see your doctor in person in order to have that medicine prescribed? So, a lot of questions.
Yeah, I think that's the kind of thing where there will be some kind of potential coordination. Everybody's looking at Amazon to see when they're going to get into medical care and kind of prescription drug distribution, because they've gotten so good at distribution. This is one of the things where if Amazon were to get into this, I would imagine it would be something like, if you are seeing, for example, a heart specialist at Stanford, but you live, I don't know, in Guerneville or something, then I can very much see that that specialist at Stanford in Palo Alto kind of doing a mixture of remote medicine and getting a local doctor out to see you, so that doctor can perform some of the assessments or anything that they might like to do, and then communicate their professional opinions back to that specialist. Something like that, where you actually have a network doing what a network should do, which is having local nodes do some of the jobs that remote systems aren't in place to do directly.
Yeah, that's a good point. So, like with all this stuff that we talked about today, what do you see with your research that's in the pipeline for the next 5 years? Like, where do you see this going?
Well, I think that we're going to see a lot more online remote medicine. I think it's going to become more and more comfortable for people who are at risk. And ultimately, when you think about anything within the medical industry, you're going to kind of think about older people. So as they get more comfortable, as they get more devices, and everybody gets either laptops or Echo Shows or whatever other devices are available to them in order to kind of remotely contact someone, then it's going to become more and more frequent. And I also think it's going to end up being kind of like the primary use case is going to be that remote triage. It's something that I used a lot for my pets, because they're getting older and they can't tell me how they're feeling. So I have to kind of, like, if I notice something weird, then it becomes like, oh, hey, let me drop into a chat with a vet and then tell them what I'm seeing, and they can tell me whether or not it's serious enough that they need to be taken to the vet, or if I should keep an eye on them. So I think that's going to be one of the biggest use cases is, hey, I've got this thing going on, should I come in? And just determining kind of that triage of like, yes, you should come in, or no, just take some Tylenol. Beyond that, I think we're going to see growth of everything. We're going to see remote testing for drop-off of urine tests or fecal matter tests or saliva tests, those kinds of things. We're going to see health monitors that are already built into Apple Watches and Fitbits and Android devices. Those are continuing to get better and more efficient and become a little bit more forward in kind of use case presentation. And then hopefully, we're going to see better information and record sharing between the different healthcare providers. And we'll hopefully see some of the companies that are very, very good at data management, whether that's a Google or a Salesforce or somebody like that, stepping in and providing kind of platform as a service capabilities to healthcare providers, so that the data is always there, it's encrypted, and it's very safe and very efficient.
Yeah, I would agree with you. I think that the one that matters the most to me is the integration between healthcare providers. Yeah. Like, I feel like once you have a really efficient process that shares all of your data, so it doesn't matter what doctor you go to, whether you're a primary care physician or your specialist, that they have all of your records. One click of a button, put in your code, all of your data comes up. They can look at it and see how it correlates with some of the issues you might be having, or how you can live a healthier life. And then also the other one is the delivery of medications. Like, I don't think you should have to go to CVS pharmacy and stand in line to get your medications anymore. I think that they should be delivering those medications as long as they're certified and they know it's going to the right person. I think that Amazon's going to jump in on this. I think that Walmart is going to jump in on this. I think those delivery of tests that you talk about, I think it could be done by Amazon, Walmart, USPS, UPS, FedEx. I feel like the healthcare industry can use those utilities.
Mhm.
And we can really streamline this process and make it easier and more comfortable for people to get the care that they need. I mean, I'm really bullish on this industry. Like, I just feel like the next 10 years are going to make the past 20 years look like the Stone Ages. I really do. I feel like there's a lot of momentum right now, and I think we're on the right track. I don't really see much of a downside to it, because I feel like the downside is related to design. And I've said this before, as long as doctors and healthcare providers like your brother are part of the design process for these tools and this type of technology that we're talking about, I think we're going to do okay. I think it's going to be better than the previous decade.
Yeah, I think the big thing is making sure that this isn't used as a as an excuse to cost cut. It is a
Correct.
means to increase capacity and capability at existing costs, or to make additional investments into medical care go further.
I agree. Well, with that said, I think this is a wrap for today's episode. This was fun. Thank you to all of our listeners. Please share this episode with a friend. Tell them to listen to the other episodes we have if they're interested. Also, Demetrius has been a bit more bullish on managing the Twitter account. So we're going to try to put links to some of the data that we talk about on that account. So if you have an opportunity to check it out, please do. And thank you again, and we'll see you all next week.